we're going to be talking about three kinds of perspectives on abnormality, on human emotional distress. Biological perspectives say that mental distress is caused by underlying malfunctions in your biology, in your anatomy, in your physiology. And so your brain neurochemistry, your genes, brain structures, your immune system, viral infections, all of those are going to be understood as causes of mental distress. By comparison, psychological perspectives are going to say that mental distress is caused by the way you think, by the way you feel, by the way you process information. Finally, sociocultural perspectives are going to say that mental distress is better looked at as a social problem rather than as an individual problem. So things like poverty, oppression, racism, socioeconomic inequality, all of those social factors are going to be the main causes of emotional distress. In comparison to, for example, biological perspectives, which say emotional distress is caused by something broken in your underlying biology. So those are the three main perspectives we're going to talk about, and your job, should you choose to accept it, is going to be trying to figure out which of those perspectives you most adhere to and why. Right, so what is the difference between a psychiatrist and a psychologist? Well, a psychiatrist is a medical doctor. Psychiatrists go to medical school and then they specialize in psychiatry. They can prescribe medications, and in fact, most of the time, in the United States anyway, psychiatrists mainly consult with their patients and prescribe medication. That's the main thing they do. They don't do a whole lot of psychotherapy anymore, in most instances. A psychologist, on the other hand, has a doctoral degree, either a PhD, or research and practice degree, or a PsyD degree, which is a more pure practice degree. But both of the PsyD and PhD degrees are doctoral degrees. They're not medical degrees. And so psychologists tend to, if they specialize in clinical or counseling psych or school psychology, they tend to be psychotherapists. They tend to engage in assessment and counseling and therapy with their patients. And so that's the main difference. And you'd be surprised how often people are really confused by that, but now you know. You can see from Chapter 1 there's a lot of disagreement about how to define what a mental disorder is. So Dr. Jerome Wakefield of Columbia University came up with a definition that he's tried to say is the best way of defining it. And essentially, this is his harmful dysfunction model of mental disorder. And he says in order for something to count as a mental disorder, there has to be two components. First of all, there has to be an internal dysfunction in the person, right? Something wrong. Some mental mechanism has to be not working right and broken. Right? That has to be there in order for somebody to have a mental disorder. But that alone isn't enough. There also has to be the notion of harmfulness. In other words, the society has to judge the results of that mental dysfunction, the way in which it impairs or affects behavior. They have to judge that as problematic. And so if you have a harmful internal dysfunction, you have a mental mechanism that's not working, and you have a society that says the way in which that mental mechanism affects behavior is unacceptable or is problematic. And that is how you define mental disorder in terms of both internal factors and social judgment. That's Wakefield's attempt to solve the problem. A lot of people have disagreed as to whether or not it's a good solution. What do you think?